My name is Jen Sosa, and for my HTR 200 class, I conducted research on the positive effects of art therapy in CVA patients with right brain damage. Cerebrovascular accident or stroke is the sudden death of some brain cells due to a lack of oxygen when the blood flow to the brain is impaired by blockage or rupture of an artery to the brain. If the stroke occurs on the right side of the brain, the left side of the body is paralyzed and causes vision problems as well. Immediate medical intervention will be needed to save the patients because of the depravity of oxygen due to a blood clot in a vessel. Some signs and symptoms of RCVA include slurred speech, droopy face, confusion, difficulty balancing, and trouble seeing. Here are some of the effects of RCVA on patients' domains of life. For their cognitive domains, they experience perceptual problems, decreased eye-hand coordination, short attention span, poor spatial orientation, and concepts of direction. For their psychological domains, they have impaired concrete thinking and sleep disturbances. Effects on their physical domains include left hemiparesis, hemiplegia, left side neglect, decrease or increase in sensation, change in vision, and reduced range of vision on the left side. For their social domains, they experience depression from being bedbound and shame due to impairments in certain abilities, and also possible dysphagia, which is difficulty for them to communicate. Art therapy doesn't have an established course by itself. However, it is performed under the supervision of licensed clinicians in the field of psychology. 5 of the influential writers who developed art therapy as a recognized field during the 1940s were Margaret Nomberg, Hanna Kwiatkowska, Florence Kane, Edith Kramer, and Eleanor Ullman. Margaret Nomberg, or the mother of art therapy, is the primary founder of the American art therapy movement. She believed that children who expressed themselves creatively would experience healthier development. Nomberg surmised that art therapy is a form of communication that conveys emotions and therefore can be used for healing treatment. Kwiatkowska can implement art therapy for patients and families with psychological disabilities despite her original goal for art therapy for intellectual disability. This shows that art therapy could work for combating the psychological symptoms, which are depression, anxiety, and avoidance. The benefits of using art therapy with RCVA patients is that art therapy can improve concentration and communication and can help reduce feelings of isolation. Patients will likely be self-conscious about their appearance and language difficulties. These clients will need the person-centered activity analysis from the recreational therapist. By placing them in group settings, but allowing them to work individually, CVA patients would be able to express themselves and share what the experience was like. By using a bigger canvas and bright colors might be able to stimulate their cognition and use the space to freely express themselves as well. Most CVA patients will need life skills training since they seem to be forgetful, irritable, careless, and confused. It's important for the client to work with their significant others and a TRS to be able to identify leisure interests and opportunities in order to improve their optimal health. For my activity analysis, I chose to write about watercolor Zentangle. Zentangle is an easygoing activity that only requires people to enjoy the simplicity of drawing and creating patterns. This activity will take place in the dining room, set to work in a group setting to work individually. The materials needed are paper, fine point black pens, pencils, watercolor paint, paintbrushes, cups for water, and a Bluetooth speaker for music. The goals of this activity are to reduce anxiety, promote feelings of peace, and to allow focus on the present moment. For every activity analysis requires some accommodations. Most people are right-hand dominant, although it may be an issue for those who are left-handed. By working alongside an occupational therapist, they can help train clients to use their right hand to accommodate those who are experiencing difficulty. Depending on the size of the group, using 4 to 6 tables set together can be accessible for those who use a wheelchair. Each patient will be set next to each other for both those participants observing. Those who use a wheelchair will sit on the outside corners. It'll be easier for them to maneuver in and out of the dining room. Materials provided for those who may have visual impairments would be a bigger canvas and the use of thicker markers. By drawing with thicker marker, it can help them see their creation with bold patterns. In order to set up the client's care plan, these questions should be asked to encourage communication with the patients as soon as they are admitted to the facility. Those questions are, do the patients have any visual and/or hearing difficulties? Do patients like participating in group activities, and what kind of activities interest those patients? To conclude, immediate medical intervention will be needed to save the patients because of the depravity of oxygen due to a blood clot in a vessel. However, as a recreation therapist who will be dealing with the rehabilitation steps of the medical services, knowing how to approach each symptom of RCVA is crucial for us. This is because of our goal of providing help and resources for our patients in order to give them the opportunity for the patients for the best quality of life. Art therapy can help facilitate this by combating the psychological symptoms of living with stroke.